Good evening, my dear students. As you know very well, I am Dr Jayaprakash K, Professor of Forensic Medicine and Toxicology. I always say that be happy, make others happy, if possible, grow old gracefully, and die with dignity. Okay. Now, today's session, let me speak on snake bite envenomation. Today's session is snake bite envenomation. I am going to talk about half an hour, which is most important. Whatever the exam you take, whether it is NECET or NEET or FMG, whatever it is. Okay. Now, coming to India. In India, there are 4 snakes, venomous snakes, which is most common on land, and one more is of course sea snake. Now, elapids and vipers are which is present on land, on the earth. Sea snakes, of course, in the sea. Okay. Now, there are 2 elapids, namely common cobra and common krait. At the same time, there are 2 common vipers called Russell's viper and saw-scaled viper. Okay. So here, out of these 4, common cobra, common krait, Russell's viper and saw-scaled viper, out of these 4, most common is again common krait. Okay. Elapids are always neurotoxic. Elapids are always neurotoxic. Vipers are always vasculotoxic or hemotoxic, and sea snakes always musculotoxic or myotoxic. Okay. Now, what is the cause of that? In neurotoxic snakes, always death is due to paralysis of respiratory muscles, so respiratory failure. And in case of vipers, it affects the blood, vascular toxic, and person dies of circulatory failure. And again, sea snakes is myotoxic. It affects the muscles of respiration. Again, death will be due to respiratory failure. This is the basics of these venomous snakes in India. Okay. There are so many other snakes also, like king cobra will be there, pit viper will be there, hump nose viper will be there. All these are there. Okay. Even banded krait is there. But these 4 are very common. Okay. Now, look at the question. Original, they used to ask for NEET PG. The venom of krait is, of course, you know very well, the answer is neurotoxic. Elapids are neurotoxic. Simple question. Okay. Now, especially in NECET, even sometimes even FMG also they showed some pictures of the snake. Ophioophagus hanna. Ophio means snake. Phagus means eating. The snake which eats other snakes, that is king cobra. King cobra, the length is even more than 4 meters. It is the longest snake in India. At the same time, it has got a hood. Sometimes the students will get confused between the common cobra and king cobra. What is the difference? Difference is you look at the back of the hood. There is no spectacle mark in king cobra. There is no spectacle mark. Okay. Number 2, naja. That is the scientific name. Common cobra. Common cobra. Common cobra can also develop even up to 3 to 3.5, maximum 4 meters. But king cobra can go even more than 4 meters. Okay. And how to identify? Common cobra also has a hood, and on the back of the hood you can see spectacle mark, as you see in the first and second picture, and sometimes the monocle mark, especially the Burmese common cobra will have monocle mark. Okay, that is naja or common cobra. And as I said, it is a spectacle or monocle mark on the hood. By that, you can differentiate between king cobra and common cobra. Now, you look here, maxilla and mandible. The maxillary scales are known as supralabial scales. Mandibular scales are known as infralabial scales. The median one you have to leave. Look at this one. Number 1, 2, 3. 3. The third supralabial, look at the picture, it touches both eye and nostril. third supralabial touches both eye and nostril. Sometimes they may give only the picture of this head, then you can identify the snake. Okay, and even they ask a question also previously in NETS exam. Third supralabial touches both eye and nostril, and answer is common cobra. Okay, Bungarus ceruleus, common name is common crate. How to identify? It is normally a thinner, it has got a thinner body, and not always, majority of the time, there will be thin stripes on the body. Not always. There will be thin stripes. Whereas banded crate has got thick bands, here the thin stripes will be present on the body. Okay. At the same time, you look at the another picture, you can see the thin stripes. Bungarus ceruleus is the scientific name. Okay. Now, look at the back. In the back, it has got central row of hexagonal scales. Central row of hexagonal scales on the dorsum. That is the second identification feature of Bungarus ceruleus. Okay. Central row of hexagonal scales on dorsum is seen in common crate. Common crate. Okay. Number 3. I told about the third supralabial is largest in case of common cobra. But here you look at the infralabial, that is mandibular scales 1, 2, 3, 4. The fourth infralabial is largest. Fourth infralabial is largest. Okay. Now, coming to the Bungarus fasciatus, means Bungarus ceruleus is common crate. Bungarus fasciatus is banded crate. Why it is known as banded crate? You look, there are thick bands on the body. Thick bands on the body. The thick bands may be white or maybe yellow. Maybe white or maybe yellow. You can see the thick bands. That's what is known as banded crate. So far in the examination, they have not asked you to identify the Bungarus fasciatus. I will show you one question which is asked in NEET. Okay. The scientific name of common crate is Bungarus ceruleus. Okay. Fourth infralabially largest in common crate. Now we got all the basic questions. Okay. Next, coming to the Russell's viper. Scientific name is Daboia russellii. Daboia russellii. How to identify? Now we know very well how to identify the king cobra, how to identify the common cobra, how to differentiate between king cobra and common cobra, how to identify the common crate. Number 4, Russell's viper. Look at the head. It has got a triangular head with narrow neck. Triangular head with narrow neck. At the same time, you see on the dorsum, it has got 3 rows of diamond-shaped marks on the body. 3 rows of diamond-shaped marks on the body. Easily you can identify. Sometimes you may have confusion between python and Russell's viper. But python, bulkiest snake, number 1. Number 2, it has got the marks on the body, but marks are irregular. It is not exactly 3 rows. I will show you later. Okay. Now, I will show you another picture. You can see the 3 rows, one on the central, another on the sides of the body. 3 rows. See the another picture. Very easy to identify the snakes. Okay, not a big deal. Okay. Now, one more picture. See, 3 rows of diamond-shaped marks on the body. Okay. Now, Echis carinatus, also known as saw-scaled viper. Saw-scaled viper. Okay. Echis carinatus. Why it is called saw-scaled viper? Look, the scales at the junction with the belly. When the scales are starting at the junction of the belly with the body, the back, you can see zigzag scales just like the edge of a saw. That's why it is known as saw-scaled viper. Saw-scaled viper. Okay. Now, look at the question here. Match the following. Ophiophagus hanna, the snake which eats other snakes, is king cobra. Naja naja is common cobra. Echis carinatus is saw-scaled viper. Bungara ceruleus is common crate. Common crate. Okay. Crotaline or pit viper. So far they are not asked in the examination, but they may ask in the examination. Simple pit. A pit, a depression is seen just in front of the eye, behind the nostril, between the eye and nostril. You can see a pit. By that, you can identify the pit viper. Okay. Now look at another picture. You can see a pit. Crotaline is the scientific name, or common name is pit viper. Now, I already told about the python. Python is the bulkiest snake. And it has also got marks on the body. The marks are irregular, not exactly 3 rows what you see in the rhesus viper. That is python. The scientific name is Pythonidae. Pythonidae. Look at another picture. Look at the marks. Now you have become expert in differentiating as well as identify the different snakes. Okay. Now, this question asked in November 2019 AIMS exam. Match the following snakes with their names. Definitely you know, number 1 is common crate. Number 2 is common cobra. Number 3 is rhesus viper. Number 4 is Echis carinatus, saw-scaled viper. Number 5 is python. Number 5 is python. Okay. Which is the most potent venom? Which is the most potent out of all the snakes? Which is most potent venom out of all venomous animals? The most potent venom is of jellyfish. Jellyfish. Next is scorpion. Third is snake. Out of all the snake, most potent venom is of common crate. Okay. You understood? Most venomous is jellyfish. Next is scorpion. Now we may think, how come scorpion? Death is rare. Death is rare because it injects very small amount. It injects very small amount, which is not sufficient to kill a person. But even I have seen 2-3 deaths by scorpion sting has seen. But that is, the size of the scorpion was bigger and the age of the person was smaller. In the sense, in case of children, it may be sufficient. Okay. Now, you got the answer. It is jellyfish. The most potent venom is that of. Now they are given scorpion and snake. Scorpion. Scorpion. And if at all they ask only the snakes, then as I told, it is common crate. Common crate. Okay. What is the first neurological sign in elapids? I think all of you know. That is also one of the most important simple question. The most important, the earliest neurological sign in elapid is ptosis, drooping of upper eyelids. Drooping of upper eyelids is the first neurological sign. You know very well, elapids are neurotoxic. Okay. Ptosis is the earliest neurological sign. After ptosis, there will be diplopia, dysphonia, dysarthria, as well as dyspnea. Generally, they say there are 5 Ds and 2 Ps. First P is ptosis, second P is paralysis. 5 Ds are, as I said, dyspnea, dysphonia, dysarthria, dysphagia. All these are Ds. Okay. Earliest neurological sign in elapid bite is ptosis. Ptosis. What is the most useful bedside test for human toxic poison? In other words, it is very simple. When these 4 snakes are very common in India, if a patient presents you, then you have to look at the sign. If you see the ptosis, you should think in terms of elapids. If you see the clotting time, if it is increased, then it is vasculotoxic poison, that means vipers. So most useful bedside test for human toxic poison is 20 minutes whole blood clotting time. 20 minutes whole blood clotting time test you have to do. Okay. The most useful bit is said to suggest snake bite envenomation is 20-minute whole blood clotting time. Okay. Now, in snakes, this is another important point to answer some MCQs. Let me say, local signs are almost nil. Sometimes there may not be any bite, sting, fang marks only. Sometimes there may be only scratch mark, sometimes only symptoms will be there. That is in case of common crate. And local signs are maximum in viper. So local signs are almost nil in case of common crate, maximum in case of vipers. What about the convulsions? Convulsions are not at all seen in case of vipers because viper is hemotoxic poison. Whereas maximum in vipers. Okay, look at the picture here. Local signs are almost nil in case of common crate, maximum in vipers. Convulsions are nil in vipers because viper is hemotoxic poison, as I told. Most common in common cobra. Convulsions are most common in common cobra. Okay, that regarding the basic signs, what you see, and convulsion. Local signs are almost nil in common crate. Convulsions are most common in viper. Okay, convulsions are more common in common cobra. Okay, whereas local signs are almost nil in common crate. Okay, now, was they asked a question in July 2020? Tall peak T wave of ECG is associated with which snake bite? So here snakes are only crate and hump nose pit viper, whereas Mesobuthus tamulus and Cactidae both are scorpions. Okay, now it is a common sense question. You see, vipers are hemotoxic. Hemotoxic means there will be hemolysis. RBC contains potassium, so it gives rise to hyperkalemia. Hyperkalemia gives rise to tall peak T wave in ECG. So answer is hump nose pit viper. Hump nose pit viper. Okay. If a snake bites you, what should you do? If a snake bites you, what should you do? Don't get scared. Most of the people, sometimes the people may die just because of fear and anxiety. But don't get scared. Be cool. Be cool. Already it is bitten. What to do? Think about the first aid as well as going to the hospital and getting treatment. Okay. Now, don't get tense. Just call a friend who is very close to you. Close to you means close by geographically. Geographically should be close, not close by heart. If your friend is in America, if it is bitten in India, don't call him. He cannot do anything. You call somebody who is very close to your location. Okay. Then the first aid. The best first aid is immobilization. Best first aid is immobilization. What you can do? You can apply a splint. Application of splint. So you can immobilize the bitten part. Usually snake bites the lower limb. It may bite anywhere. If a person is sleeping, it may bite on the head, face, wherever it is. Or if a person puts hands into bushes, it may bite the hands also. But usually the lower limbs. Okay. Best is immobilization. Assurance. Give assurance. Don't worry. Nothing happens. It may not be snake bite. Even if it is snake bite, it may be non-venomous snake. Even if it is venomous snake, don't worry. Only small quantity must have been injected. Even if it injected a larger dose, don't worry, I am taking you to hospital, or you are already in the hospital, anti-snake venom is there, don't worry. So that is the assurance. You can relieve him from his anxiety. Okay. Do not wash the area of the bite. Don't wash the area of the bite. Previously we used to say wash the area, but don't wash under running water. Gentle wash can be given, but nowadays in all the books they say don't wash. Maybe because the Indian doctors are influenced by the foreign journals where they say, for example, in America or Australia, if a snake bite case comes to the hospital, they take local swab, then they analyze the venom, identify the snake. If you wash, they cannot analyze the snake. That's why they say don't wash. But in India, there is no provision to identify the snake by the swab. Whichever the venomous snake bites, here we have only polyvalent anti-snake venom. Okay. But in the exam, just say that don't wash the area. Okay. No tourniquet application. Don't apply tourniquet. It may give rise to. Generally, what happens? No, this venom is passing through the lymphatics. You cannot apply tight tourniquet. Then you may block the circulation. It may give rise to gangrene formation. So as of today, no tourniquet application, but you can apply Sutherland method or Sutherland wrapping, that is pressure application by crepe bandage. What Indian guidelines say is, if we can take the patient to the hospital within 30 minutes, no need to apply. If it takes more than 30 minutes, but if you reach within 3 hours, you can apply crepe bandage along with the splint. Whole limb of bitten limb, you have to apply the crepe bandage with the splint. Splint should be there. At the same time, the wrapping should not be so tight. You should be able to pass one finger under the wrapping. Okay, that can be done. No incision at suction. No incision at suction. Olden days, they used to say, put a cruciate incision, make sure that there is no wound in the mouth and suck the venom. Don't do that. Okay. No ice application may give rise to vasoconstriction and later gangrene formation. No ice for application. Just avoid the snake. Try to identify the snake. And nowadays, most of you will be having mobile in your hand. Immediately take the mobile and click a photo of the snake. Okay. That we can do. Go away from the snake. Otherwise, if you go behind, if you follow the snake, again it may turn and bite you back. Don't do that. Okay, go away. Don't run. Immobilization is very, very important. Immobilization is very, very important. So don't run. Okay. And if at all you have any anklets or anything, just remove that. Because it may disturb the bite area. At the same time, if you are having any tight leggings or tight clothing, cut it. So that it may not give rise to compartmental syndrome later. Okay. Of course, if a snake bites in the vicinity of your house, no need to cut and waste your pant. You can go to the room and you can change the dress and wear some loose clothes. But if it is outside, you cannot do that. Just cut it. Okay. Next. Don't take revenge by biting the snake bite. Hey, you have bitten me. I will take revenge. I bite you back. Don't do that. Snake is an innocent animal. It doesn't know. It is not biting you because it got some grudge or anything. It is the nature of the snake. Okay. Don't do that. Don't try to kill the animal. I am going to die anyway. Before my death, I am going to kill you. Don't take revenge. By that, again it may come and bite you. Okay. At the same time, some people think that you have to catch the snake and take it to the hospital, dead or alive. So the doctors will identify that snake and give you the best treatment. Don't do also think you are wasting your time unnecessarily. Same time, you are mobilizing your body. At the same time, snake again may bite you. Don't do all such things. Okay. Don't do that. Which of the pre-hospital measure is most acceptable in case of snake bite? The most acceptable in case of snake bite is application of splint. You have to apply a splint. Okay. What is the hospital treatment? Once the patient comes to you, don't be over enthusiastic and start giving anti-snake venom immediately. You just wait and watch for the signs and symptoms. If at all there is delayed clotting time or ptosis, then you can toss polyvalent anti-snake venom with 10 vials. PASV, polyvalent anti-snake venom, you can give with 10 vials. As all of you know, polyvalent anti-snake venom is effective against 4 commonly available venomous snakes in India, that is common cobra, common crate, rhesus viper and saw-scaled viper. Okay. Common cobra, common crate, rhesus viper and saw-scaled viper. Meantime, remember, the PASV prepared from Hopkins Institute or Hopkins Biopharmaceutical Company, neutralizes the venom of pit viper due to paraspecific activity. This is very, very important. I will show you one question. Why it is important? Okay. That is given in even in case of bite by pit viper. Bite by pit viper. Okay. If indicated, PSV started with 10 vials. Here, another most important is not given in your undergraduate textbook. Fixation of toxins. In case of common cobra, the toxins get fixed at postsynaptic region. Whereas in case of common crate, it gets fixed at presynaptic region. That's why, remember another important point, neostigmine has no role in common crate, whereas neostigmine is indicated in common crate. Now, first point I said, PSV can be given even in case of pit viper, if it is manufactured from Hoffman's biopharmaceutical company. Number 2 is, don't give neostigmine in case of common crate because it is waste. It is fixed at presynaptic region. Okay. Neostigmine indicated in case of poisoning by common cobra. At the same time, if the examiner study only the undergraduate textbook, then he may give a question, neostigmine indicated in case of poisoning by, then your answer should be Elapidae. Elapidae. Okay. A patient with issue of snake bite comes to emergency after 6 hours on examination. There is mild local edema at the bite site with no other signs. Laboratory investigation, normal report. Most appropriate management is, I told you already that, wait and watch. That's all. Wait and watch. That's all. Okay. Now, the question asked in FMGE August 2020, a man was admitted in the hospital with an allergic disturbed snake bite and showed the signs as shown in the picture below. What you can see in the first picture is ptosis. Once there is ptosis, you can rule out viper. So, answer is common cobra or common crate. As per the history, his friend saw him lying on the ground and they took the picture of a snake. I already said common cobra has got a hood whereas thin stripes on the body in case of common crate. So we came to know it is a neurotoxic poison and common crate. The cause of death is, I told you, even if you are not in a position to identify the snake, definitely the answer is respiratory paralysis. Respiratory paralysis. Okay. First statement is Ames number 50. PASV may be given in pit viper bite. I told. PASV manufactured in Hopkins biopharmaceutical company can be given. Cobra venom is neurotoxic. That is also true. Atropine pre-medication should be used before administering neostigmine. That already was studied in pharmacology. Neostigmine has a role in crate bite is wrong. It has got a role only in common cobra, not in common crate. Okay. Now you got the answer. Okay. First statement regarding snake bite, Ames June 2020. ASV is the mainstay of treatment. That is true. Neostigmine and ventilatory support may be given along with ASV in cobra bite. Yeah, cobra bite, neostigmine is indicated because of the respiratory paralysis. Ventilator support may be required. That is also true. Indian polyvalent anti-snake venom is not effective against hump-nosed viper. That is also true. ASV plus neostigmine plus atropine indicated for treatment of crate bite. That is wrong. Crate, we don't give neostigmine. We don't give neostigmine. Okay. Now, which is true about ASV? Lower dose in infant as compared to adults. That is wrong. Wrong. Because here we are giving anti-snake venom to neutralize the amount of snake venom. Whether it is a child or adult, the dose is same in case of snake bite. Sensitive test is must be done before ASV. No, because you have to start neutralizing the venom as early as possible. Even the person is sensitive under the steroids and adrenaline, you have to give the ASV. So you give the ASV, if you start reacting, anaphylactic reaction, whatever it is, then you have to give the counteracting drugs. Okay. Useful for venom associated coagulopathy in viper bite. That is true. Cobra venom acts at presynaptic region. Wrong. Postsynaptic. Common crate venom causes both internal and external ophthalmoplegia. True. It is neuroparalytic venom. Okay. A 12-year-old boy had an alleged history of snake bite and presented to the hospital with inability to open eyes well and difficulty in breathing. It is a neurotoxic poison. That means maybe common cobra or common crate. He is very anxious and is having tachycardia and tachypnea. On examination, bite mark cannot be visualized. I already told you, in case of common crate, most of the time there may not be fan mark, there may be scratch or there is no bite mark at all. And there is no swelling of the limb. Minimum, almost nil local signs in case of common crate. He has bilateratosis again, neurological. His 20-minute whole blood clotting time is good quality. That means it is not vasculotoxic, it is not a viper. What is the next course of action? So now we came to know that it is common crate. Don't give ASV, but observe the patient. No, because signs and symptoms are there. That is wrong. You have to give. Give ASV and keep the patient on observation. Give ASV and neostigmine and observe the patient. Now you see, difference between B and C. C says that you have to give neostigmine, but neostigmine is not indicated in case of common crate. Reassure the patient and send him home with anxiety. No, you have to give ASV. So here, what you have to give is only ASV. And you have to keep him under observation. If at all there is paralysis, respiratory paralysis, you may have to put him on ventilator. Okay, so now we got the answer. Okay. First aid and hospital management for snake bite envenomation is, this is a recent question asked in INICET November 22, last exam. Kill the snake. I said, don't take revenge. Don't kill the snake. Immobilization. Yes, you have to do. Wash the wound. No, you should not wash. Incision suction. No, you should not do. Application tourniquet. No. Administration of anti-snake venom or polyvalent anti-snake venom. Yes. So, answer is B and F. B and F. That is regarding important aspects of snake bite envenomation in forensic medicine and toxicology in connection with your common entrance examination, maybe INICET, maybe NEET, maybe FMGE. Okay. Bye-bye. Thank you very much. Good night. Bye. Wish you all the best in future. Don't take any stress in your life due to the exams. You just do your duty. Don't waste your time unnecessarily. If you are first, second year, third year, fourth year student, start reading all standard books, not only some notes or whatever it is. Standard books you have to study. You have to keep proper concept in your mind. Then later, whether it is NExT or NEET, subject, what you know is important. Don't worry whether next year is NEET, next year is NExT. Anyway, you don't worry about anything. Okay, just keep the knowledge properly in your mind. And once you become a doctor, be compassionate to your patients and maintain the ethics in your life. Definitely will come up in your life. And you'll be considered as one of the good doctor or best doctor or fantastic doctor by the society. Okay, bye-bye.